Cleocin Cream is used to treat a certain type of vaginal infection, bacterial vaginosis. Active ingredient clindamycin phosphate. Clindamycin is an antibiotic that works by stopping the growth of bacteria. Indications. Cleocin vaginal cream is indicated in the treatment of bacterial vaginosis, commonly referred to as Haemophilus vaginitis, Gardnerella vaginitis, non-specific vaginitis, Corynebacterium vaginitis, or anaerobic vaginosis. Cleocin vaginal cream can be used to treat non-pregnant women and pregnant women during the second and third trimester. How to use. The recommended dose is 1 applicator full of clindamycin phosphate vaginal cream, 5 grams containing approximately 100 mg of clindamycin phosphate intravaginally, preferably at bedtime, for 4 or 7 consecutive days in non-pregnant patients and for 7 consecutive days in pregnant patients. Disposable plastic applicators are provided with this package. They are designed to allow proper vaginal administration of the cream. Remove cap from cream tube. Screw a plastic applicator on the threaded end of the tube. Rolling tube from the bottom, squeeze gently and force the medication into the applicator. The applicator is filled when the plunger reaches its predetermined stopping point. Unscrew the applicator from the tube and replace the cap. While lying on your back, firmly grasp the applicator barrel and insert into the vagina as far as possible without causing discomfort. Slowly push the plunger until it stops. Carefully withdraw applicator from vagina and discard applicator. Remember to apply one applicator for each night before bedtime or as prescribed by a doctor. Contraindications. Cleocin vaginal cream is contraindicated in individuals with a history of hypersensitivity to clindamycin, lincomycin, or any of the components of this vaginal cream. Cleocin vaginal cream is also contraindicated in individuals with a history of regional enteritis, ulcerative colitis, or a history of antibiotic-associated colitis. Warnings. Pseudomembranous colitis have been reported with nearly all antibacterial agents, including clindamycin, and may range in severity from mild to life-threatening. Orally and parenterally administered clindamycin have been associated with severe colitis, which may end fatally. Diarrhea, bloody diarrhea, and colitis, including pseudomembranous colitis, have been reported with use of orally and parenterally administered clindamycin, as well as with topical, dermal, and vaginal formulations of clindamycin. Therefore, it is important to consider this diagnosis in patients who present with diarrhea subsequent to the administration of clindamycin, even when administered by the vaginal route, because approximately 5% of clindamycin dose is systemically absorbed from the vagina. Systemic clindamycin has been shown to have neuromuscular blocking properties that may enhance the action of other neuromuscular blocking agents. Therefore, it should be used with caution in patients receiving such agents. Adverse reactions. Candidiasis, vaginitis, vulvar-vagina disorder, fungal infections, pruritus, abnormal labor, hypersensitivity reactions, acute kidney injury.